My name's Dr. Adam Haycock. I'm a consultant gastroenterologist here at OneWelbeck, and I also work in the NHS at St Mark's Hospital, the National Bowel Hospital. So bowel cancer is one of the commonest cancers in the UK. It comprises three different types. When we say colorectal cancer, we mainly mean cancer of the colon, which is the large intestine, but it also includes rectal cancer and anal cancer. Between the three of those, it's the fourth most common cancer in the UK. So the early signs of bowel cancer are unfortunately quite wide, and a lot of symptoms can be as a result of bowel cancer. They can also be as a result of a number of other diseases or just from simple things like infections. Things to watch out for would be a change in bowel habit, any significant weight loss that's unexpected or unexplained, rectal bleeding, or if you do some tests with your doctor, bleeding that you cannot see but is picked up on various stool tests. There may also be other symptoms such as abdominal pain, bloating, and discomfort elsewhere, but those are, as I said, very widespread and quite common with lots of other conditions. Any patient who has any of those symptoms should at least get them checked out. That would really firstly be a consultation with a doctor who can assess those symptoms and decide what the likelihood of this being caused by something simple and not worrying, or perhaps as a sign of potential bowel cancer. So the main causes of bowel cancer are actually genetic. So it's a lot to do with your hereditary, and so whether you have a significant risk of bowel cancer may come from whether your parents or close relatives have bowel cancer. But aside from that, then it's just the genetic changes that we tend to all pick up as we get older. Bowel cancer is much more common as we get older, so the risk is significantly higher in people over the age of 50, and as you get over the age of 60, 70 and 80, it obviously becomes much more common as well. There are probably some environmental factors that we know contribute to people's risk. Those would be things like smoking, which is probably the most significant risk factor for any cancer, so stopping smoking is one of the best things you can do for yourself. Other risk factors would be obesity, lack of exercise, and a poor diet. Other things in the diet that may contribute but are not necessarily so important are things like eating lots of processed meats or carbonized meats such as barbecues. So the key thing about bowel cancer is to get it picked up early. Ideally, we want to pick up the precancerous polyps and remove those, which reduces people's risk of developing bowel cancer at all. However, if people do develop bowel cancer, the risk does change depending on how early it is picked up. So if people do go to the doctor at the first symptoms of, say, bleeding or weight change or anything like that, they then tend to be at a much earlier stage and can usually be removed much more successfully with a much higher long-term survival rate than people who are unfortunately diagnosed with late-stage bowel cancer, which may end up already have spread and therefore be a terminal condition. The key thing is to get this early. The earlier the possible we can pick it up, the much better survival they have. So the treatment options for bowel cancer vary. So it does depend on the stage in which bowel cancer is picked up. For a few bowel cancers that are picked up using screening, for example, they may be very early, and for some of them they may be able to be removed using a colonoscope without any significant surgical intervention. However, the majority of cancers are not picked up that early, and they will usually require an operation to remove the cancer. Some people may also then need chemotherapy, and for certain bowel cancers, particularly anal cancers, sometimes radiotherapy is used as well. Sometimes they are used in combination, sometimes alone.